Welcome friends to CNS Viewpoint. Today we are going to talk about an important issue. It's end of February 2022, and if you see that many countries, many states in India and other parts of the world have been relaxing COVID restrictions significantly, even to the extent that some of the COVID prevention and control measures have been done away with or have been compromised significantly. In many ways, it appears as if we are going to pre-pandemic times, which is indeed all of us want that for a range of reasons. More importantly, industries want that, obviously for economy and commerce reasons. But the point here is it too soon? Is it the time? Are we done with Corona? Is Corona history? Is Corona over? And friends, the answer, as repeatedly told by the experts, senior most experts of World Health Organization, WHO, the apex health agency of United Nations, is that pandemic is not over. Of course, it's not over. The virus is circulating in our populations, even in India. If you look at the number of new cases reported daily, they have declined, yes, but has it disappeared? No. What about deaths? Deaths, very, very alarming, friends. The deaths have been on a rise. If you look at the first 6 weeks of 2022, there is not a single week when the deaths recorded in 7 days because of COVID-19 declined. So first week of January, 41,000 people lost their lives because of COVID. Second week, 43. Third week, 45. Fourth week, I think 50,000. Then 58,000 by the last week and early February. 68 or 69,000 by first week of February. And by mid-February, 75,000 people had died. There is a constant, maybe the rate may not have remained the same, but one thing is same, that deaths increased every week after week in 2022 till mid-February. So this is, and when we say even one untimely death is a death too many, do we really mean it? If we really mean it, then this is extremely deeply concerning. We are not over the pandemic. Why are people dying of COVID-19 when infection rates are on a decline? And moreover, infection rates are not on that sharp a decline that we may let go of all COVID control and prevention measures. So let me give you some statistics. Every week in January 2022, the number of people who got infected with COVID-19 recorded an all-time high, which means that in 7 days, the number of new infections occurring in the world was the highest ever since the pandemic began more than 2 years ago. So first week of January, the number was the highest ever till then. Second week of January, the first week of January record was broken and a new record was set because the number of new infections went further up. Third week, fourth week, and by end of January, the world reported 22 million new infections in 7 days. 22 million infections in 7 days. This is a huge number. And of course, it was the highest ever number of cases reported in 7 days of coronavirus pandemic in the whole of January. So by mid-February, was there a decline? Yes. By mid-February, instead of 22 million, the decline was there. And in 7 days, the number of new infections was 16 million. So from 22 million to 16 million new infections in 7 days. This is very alarming, friends. This is a lot of infections even now. So millions of infections occurring in the world The more the virus circulates, the more the risk of mutations. Vaccination and boosters, that's a whole different story, because we have had enough vaccines in the world to ensure equitable rollout and equitable vaccination done on social justice principles of everyone who's eligible around the world, in rich or poor countries, or rich and poor within same country. But we failed. We have had the vaccines, we have had the technology, we have had the people, but what we did not have was the heart to make that happen. Rather, we let selfish interests and vaccine nationalism, if you can call it, but that was so foolish, because if there is any way out of the pandemic, it is together as a humanity, and it is impossible. And even WHO experts have repeatedly told this, that if rich countries feel that they can booster after booster after booster and stay protected, that's not true, because they can't just let the rest of the world either not vaccinated at all or the vaccination being very sketchy in those parts of the world. That is just not possible. So coming back, friends, we again need to do a lot more on countering the harm which might be getting done by relaxing COVID norms so early on. It is but almost most certainly, as a common citizen, I feel, to let go of the mask, let go of the physical distancing, let go of washing hands requirement, let go of other public health and social measures. And of course, we are not talking of lockdown. Rather, we are totally against any kind of lockdown, especially the kind which was imposed or clamped in countries like India. This is just not so right. This is not even serving the public health interests. I don't know. Anyways, so coming back here to this issue, please remember, it is very early on, and even WHO experts have repeatedly said that it is very early on. We still have too many deaths happening. Even one death untimely is a death too many. We have too many infections happening. Virus is still circulating. More worrying is the fact that, friends, these numbers of deaths and new cases are underreported. We all know it is underreported. So, for example, according to a study published in Science Journal, in India, the deaths because of COVID-19 were estimated to be 6 times more than the officially reported version. So officially reported is around 500,000, and the Science Journal study estimates it to be about 3.2 million deaths. In the world, we have 5.8 million people who have died due to COVID-19 when I'm recording this, as per the internet-based COVID data source. So out of 5.8 million, more than 3.2 million occurring in India. Clearly, more than half of deaths in the world happened in India, which is a really very, very deeply worrying. And just by manipulating statistics, if we are trying to show that we have to negate that is not good enough. This is extremely worrying, the way we are undermining science and undermining data-backed and evidence-backed measures for public health, social security, and rather trying to create a more difficult situation where decisions are not entirely backed on science and evidence. So friends, let us hope all of us continue to wear masks, wear masks properly, wear masks as much as possible, maintain social distancing or physical distancing wherever possible, hand hygiene, other public health and social measures, avoid crowds, etc. Because virus is still out there. And do get vaccinated if you are eligible. Do get a booster if you are eligible. Push your governments if the policies are not backed on science, so that they do become science based. And vaccines and boosters, etc., are available, and all other health health services, because health cannot no longer be divorced of social and economic recovery path. We can't can we this was a cliche statement, but it is so deeply true than ever before, that there is no health justice, or there is no economic justice unless we really ensure health justice for everyone. My health justice, or rather I should put it, that the health justice of the poorest of the poor, most marginalized person is important, because that person's health justice is dependent on each one of ours, or vice versa. Likewise, social and economic justice of the most marginalized person is important, because even I consider myself as very privileged and with the rights and entitlements. A person like me, like all of our rights and entitlements are also dependent upon each other. It is so interdependent, and I think we have long undermined this reality. We need to turn it around. The reference point is not a privileged person like the richest of the rich, or the most powerful of the powerful, or even a common person like me who is reasonably very well entitled and enjoying rights and privileges and entitlements. But the poorest of the poor, most marginalized person, that should have been the reference point always. So let us hope that happens. With these words, with these wishes, I'll say bye-bye today and CNS Viewpoint. And tomorrow again at 5 p.m. India time, we will be back with our thoughts and views and perspectives on something that made us think. Bye till then.